question. Aaron, we've had a public plan now since the late 1960s called Medicare. How cost effective has this public plan really been? And how can we expect the federal government to run a much larger program with more efficiency and less cost?
This is a great question. I think maybe if I get the right answer, you know, we'll all go home. But yeah, this is a tough question. So let me give it by way of example. Okay, a little healthcare finance 101. Every single Medicare patient that comes to any hospital that serves Medicare patients, so I'm excluding the for-profit organizations, any community hospital, every Medicare patient we lose money on, every single one. And here's by way of example. If a patient comes in and they have pneumonia and they stay in the hospital for 1 day, it's not that complicated, or let's just say 2 days for the sake of discussion. They stay for 2 days. The hospital is reimbursed roughly $1,500. If that same patient comes in and they stay for 100 days, the compensation for that is $1,500. It does not change. It's called diagnosis-related group reimbursement, and that means we get paid by the illness rather than by the treatment. So that's on one end. We lose money on every patient that comes in who's an inpatient. We really do, because Medicare reimburses us at a rate that is lower than our costs, and I'm not talking charges. Then just put this out as a question. If you want to know if the public plan is currently working or not, how many of you have your own businesses? Okay. Ask this question to those of you who have your own businesses. I'm sure others of you are in the business world. How many of you could afford to allow your accounts receivable to go more than 200 days? Because that is the rate at which Medicaid pays for their bills. And the other question is, as business owners, how many of you could afford to have your customers pay you less than what it costs you to produce whatever it is you produce, whether it be a service or a product? That's how well it works.
There's a follow-up to that under Section 222 of the bill dealing with payments for public options. It says that the government gives $2 billion and as much money as is needed to pay claims for 90 days from the Treasury to the government plan, and it requires the government-run plan to repay the money over 10 years with no interest. There's no way a private company can come anywhere near that. I mean, these are the invidious types of things that you see put into the bill that will destroy private health insurance. Look, if everybody voted the way I do, we wouldn't have any wasteful spending.
Next question directed to Ryan. As Americans, it has been self-evident that we have sovereignty